Dr. Firas, all yours.
Huh?
After that, you are moving.
I'll see.
After break, I think it's better.
ممكن نروح على الكاس.
Okay.
Good morning. I'm Dr. Firas, trauma surgeon from Diyala. Came to here to participate in this resuscitation course and hope you will enjoy it. So our lecture today is basic life support. All of you know, you heard about basic life support, yes? What's basic life support? What's the difference between basic life support and advanced life support?
Basic life support should be done by the first witness. So
Okay.
it's not necessarily by doctors.
Okay.
Any bystander, like policemen, security person, can be trained to do it.
Okay, so not the doctor.
Yeah, it's non-hospital setting.
Okay.
Anywhere can be a mall.
So if you are on your way and there's a road traffic accident in front of you and you are a professional doctor, you are a specialist doctor, you will do it or not?
yes, I will do basic life support.
But you are a doctor.
Yes, because I don't have the equipment and the...
So is the way how to save life with no equipment, with basic resources, only the resources that you have on your way. So this way is a job of everybody, doctor, nurse, policeman, anyone, teacher, anyone in the field is responsible for basic life support. And advanced life support, who's responsible for that?
A trained person.
Trained persons, medical persons, nursing stuff. So it's a medical, okay? So we start with chain of survival. Early recognition is important, okay? And call for help to prevent cardiac arrest. If cardiac arrest already started, we should not delay CPR. So early CPR, okay? Why we do early CPR? To buy time, okay? Then early defib, if it's available, defibrillator, we should attach defibrillator, okay? Why? To restart the heart, because it's mainly cardiac problem. We are not talking about trauma mainly, we are talking about medical emergencies, cardiac emergencies. Post-resuscitation care, why? To restore quality of life. Because you know, if any chain, any circle of this, if it's delayed, there will be a problem for the patient. The outcomes will be problematic for these patients, okay? So basic life support, as we said, is sequences of procedures performed to restore the oxygenation, okay, of blood after sudden pulmonary and or cardiac arrest. So how we do this? With nothing, with the resources you have, well, with your brain, with your mind. So the steps we should follow: approach safely, check response, shout for help, open airway, check breathing, then call the emergency number, you or ask to anybody standby to call for this number. Then start CPR, as you said, early CPR. Approach safely. All of you, I think, know there is something called Dr. ABC. You heard about it? What's Dr. ABC?
Danger response.
Danger response, airway, breathing, circulation. So danger is not an A. The priority is danger. Your safety, the patient safety. Okay? It's not an A. It's D. The priority one is D. So approach safely. Be careful if there is a fire, if there is an electrical shock, if there is a road traffic accident and the patient is lying in the middle of the street, we should move the patient to the safer place in order to can do this basic life support steps to save his life. Okay? So the priority of safeties, as we said, you are the number one. Okay? The risk one. Why? You are not not the patient.
Because you are the one who is helping the patient.
Okay?
So if you have any damage, the patient will be rescued.
If you die, maybe there's 5 or 6 patients in the field. So all of them, we will lose them. We will lose their life, okay? Because you are the one who can give them a life. If you are safe, even if 1 patient die, but you can save 4 lives. This is why. It's not because you are a VIP person, no, but yes, you can save life more if you're still alive. So, risk or victim, then we think about bystanders. So check response, we need to check response of the patient. Shake shoulders, be careful not to slap the patient. Carefully shake shoulders and ask, how are you? Do you have any pain? Don't ask about name. No one cares about the names. And even the patient sometimes will not respond to you. So just ask about pain or how are you? If you respond, what you think? What the message you get? Airway patent, very important, yes. Then, the breathing is normal? Could be there is a problem in the breathing, but still he has some oxygenation, so still his breathing is still working. Okay? And? Circulation. He may have some bleeding, okay? But still there is some blood to take oxygen to the brain. Okay? Then, what else we get? The brain. The brain. His response. So he's still conscious or drowsy, but still the brain is still functioning. So still there is some oxygen going to the brain. Okay? So this is very important. If he responds to you, okay? So A and B and C and D is good. But if he's not respond, this is the problem. Why this is the problem? Because he may have airway obstruction, severe breathing problem, circulation, severe blood loss, brain damage. Okay? So, how many time? What is the time we have if the patient does not respond? What's the time we have to save this patient's life? What do you think?
To recognize or saving the patient?
To save the life. Because we think it is one of these 4, all are vital, but let me say about open airway, if the patient has airway problem, airway obstruction.
5 minutes.
What's the time we have to save it? Few seconds? Why?
Less than 3, up to 5 to 4
Up to 5 minutes, yes. Then? Or seconds? Seconds or minutes?
Within minutes, up to 4 minutes, the patient shall be provided with oxygen to the brain.
Exactly. So if the patient has airway obstruction, problem in the airway, so he has theoretically 3 to 5 minutes to survive. At time of obstruction, but when we receive the patient, we don't know when the obstruction happened. It could be, this is his last 10 seconds. Okay? Maybe the obstruction happened before 4 minutes and he has only 10 seconds to survive. So if you missed the airway and go to stop bleeding and to check breathing and you missed the airway, maybe this patient will not survive. Okay? If you respond, leave as you find him, okay? Because he's good. Find out what's wrong, reassess regularly. Shout for help, okay? We should always think about, we not always depend on ourselves. We should always ask for help. Ask for help who? Any bystanders. And we start this in case, in this slide we said, if you respond, leave him on his position. Okay? If you not respond, shout for help, open airway. How we do open airway? Head tilt, chin lift. This is for anyone can do it. Be careful of what? Cervical spine, because he may has cervical, broken his cervical vertebra. Okay? Why it's important to keep in mind cervical spine? Why it's important?
Because by the maneuver
Spinal cord is the.
So we're afraid
vital
from
point we care
paralysis?
about, yeah.
So
Is we're gonna cause small
the
problems.
breathing, yeah. And the C2, there is a nerve, phrenic nerve, okay, that supply the lungs, and that's what the broken. If you've missed cervical spine and he has broken,
You'll add much more problem for the patient.
exactly. And the patient ends with paralysis of the breathings and with ventilator until death. It's irreversible. Okay, so do we need to do airway cleaning? We talk about open airway, head tilt, chin lift. Do we need to clear airway?
Yes,
If it's accessible, like near the mouth.
If we see anything inside mouth, we need to remove it. Denture, foods, vomiting, chewing gum, anything, okay? We should remove it. But if we see nothing inside the mouth, don't try to clear the airway, okay? Because you may add further harm to the patient. If you are professional, you are a medical doctor, you are a nurse, we do jaw thrust. Jaw thrust, this is the maneuver. We put our fingers below the mandible, then temporomandibular joint. Try to move the mandible up, not the right. Why we need to do this? To elevate the base of the tongue.
Yes.
Because this is the main cause of death in unconscious patient. At the patients in supine position, he's unconscious, 100% of them will get retained base of tongue. Okay? And airway obstruction and the patient will die. So we need to do jaw thrust, okay, if you are a professional, to save his life. Check breathing. How? By this maneuver. Look, listen, feel. What we are looking for?
chest expansion.
Chest expansion. So, see here. Check on the mouth of the patient. We need to feel the air going in and out. This one. We need to hear the sounds of breathing. We need to see chest expansion. Okay? For how long? We are checking.
At least 10 seconds. At least.
It's not at least, it's 10 seconds. 10 seconds we should check breathing. Don't confuse with agonal breathing. Normal breathing. We are talking about this in practice. Agonal breathings occur shortly after the heart stops. It's up in 40% of cardiac arrest. Described as barely heavy, noisy, or gasping breathing. When you will go to the emergency, you will face this. The patient, if he's gasping, is usually the late sign. After that, rarely you can help this patient. So almost it's a sign of death. He will take a deeper breath, noisy breath, and it's only one breath. After that, you can do nothing. Okay? So call, what's the number of the ambulance here?
122.
122. So call 122. Then start. The patient is not responding, so we need to start. Not responding, we do open airway. Okay. Then we do check breathing. There's no breathing. So we start CPR. Why we are not checking the pulse?
But I think if the heart is still beating and there's ventilatory failure, is another possibility, I think.
We don't know till now. But if we return back to chain of survival, see here, early CPR to buy time. What is CPR? Cardiopulmonary resuscitation. So it is cardiopulmonary. It's not only cardiac.
Yeah, exactly.
It's cardiopulmonary. So it's give let me say, resuscitation for both lung and heart. So if there's no breath, we start by CPR in order not to lose time. Because it's a matter of seconds, as I told you. We don't know when the patient will get cardiac arrest or when his breathing gets stopped, definitely. So we start CPR, we are not going to pulse. Later on we can check after he get breathing or after that. After we get a monitor or we get AED, we can attach it, okay? But in basic life support, don't waste your time and go to check a pulse. Before it was like check a pulse then. And American also, they changed some rules that also don't check a breathing, go to check pulse in order just to buy a time because you don't have a time. So you should choose. So 30 chest compression, 2 rescue breathing. Chest compression, place the heel of one hand in the center of the chest. It is on the center, not on the left side. On the center, on the sternum. Okay? Interlock fingers, compress the chest. Right is 100 up to 120. Depth 45 cm. It's not always like that. Roughly speaking, the depth of your compression should be 1/3 of the depth of the chest. If he's obese, if he's thin, okay, it's not 45 cm exactly. It's 1/3 of the depth of the chest, and you should imagine how you need to push. So equal compression, relaxation. Okay, don't go fast, then delayed, then fast, then slow, fast, slow. You should go on the same rhythm as fast as you can. But give time for recoiling on the nun, because you just not go just fast and then no time for recoiling of the nun. You should take care of this. Be careful. You should go down and up. Give time for recoiling of the nun. When possible, change CPR operator every 10 minutes because it's very hard. It's very difficult procedure. Yes, sometimes you want to continue, but you will add further harm to the patient. You cannot continue after 2 minutes or after 4 minutes in the same power that you started with it. So, switched. Anyone can help you, even he's not a medical staff or something, anyone, but just give him instructions what to do, to put his hand here and do what you are doing. So 2 rescue breathing. Respiratory rate, give each breath over about 1 second with enough volume to make the victim's chest rise. Chest compression only. Because of the COVID and other transmissible diseases, some resources, they stop this life. If you have Al-Mubarak, if you have any facilities or resources, you can give breathing, not by your mouth, it's fine. Otherwise, you can just skip this step, okay? An important thing is 30 compressions, and why it's important one? Because it is cardiopulmonary. This breathing, rescue breathing, is just for pulmonary. So we already supported the pulmonary by CPR. Okay? Chest compression only, continue at the rate of 100 per minute up to 120. This is how to do the kiss life, rescue breathing. Pinch the nose, take a normal breathe, place lips over mouth, blow until the chest rises. Take about 1 second, allow chest to fall, repeat. Okay? Continue CPR 30 to 2, 30 to 2. If there is no resources you have to give the breathing, you can't just continue CPR for 2 minutes.
For how long do you have to continue the CPR? With the
2
patient?
minutes. Each cycle is 2 minutes. So 32, 32, 32, if you repeat it 5 times, it is at 2 minutes. If continuous CPR, you continue CPR for 2 minutes and recheck. So every 2 minutes we need to recheck. Okay?
I mean, which time do we decide that we have to stop the CPR and
Announcement of death of the patient, he means.
Mhm. We will talk about this later, okay? So that was in basic life support and outside the hospitals. Now, if you are in the hospitals and you have IED, it's not in the hospitals, it's outside in a booth, in the phone stations, in a metro station, in the bus stations, in every stations you will find some equipment called AED, some machine, AED, it's automatic defibrillator. Anyone there trained, they have instructions. If any patient collapses, just attach it to the patients, and then you see the response of the machine. The machine is very smart, and he decided when he need to give shock to the patients. Okay? So it's no need any decisions from the rescuer. It's only start working automatically. Okay? So attach AED and follow voice prompt. We will see this in the practical sessions. So this is the automatic defibrillator. Attach part to casualty per chest, and then the machine, the AED, will give you instruction. He's clear, we need to shock the patient. Okay, you should be away from the patient in order the machine to release the shock. Stand clear, deliver shock. After shock, we are not stopping. We continue CPR 32 until either it's shockable and the machine give another shock, or the patient start breathing. Okay? If the patient, if victim starts to breathe normally after that, okay, after CPR, after AED and CPR, if start breathing, we still contact this pads, but put the patient on recovery positions to protect his airway. Okay, you know why we put the airway, because also it's the matter of tongue, the base of tongue. If you put the patients in recovery positions, if you see here, if he loses conscious, the base of tongue is already elevated. It's not obstruct his airway. This is how to do the recovery. We'll talk about it in the clinical sessions. This is the difference between basic life support if you have AED and if you don't have AED. So, continuous resuscitation, this is your answer. Continuous resuscitations until qualified help arrives and take over, until the victim starts breathing normally, until the rescuer becomes exhausted. So if you are one and exhausted, you can stop that. If you, let me say, see there is no response from the patient, maybe after 5-10 minutes. But if you are 2 or 3 bystanders, you can help each other, okay? And continue until one professional can come and decide this patient is die or not. So, this foreign body airway, I think we need to talk it about in clinical sessions. Is better with airway. I will talk about it in my session. This is about Heimlich maneuver. You heard about Heimlich maneuver? You know about Heimlich?
Yes.
Airway obstruction. We'll talk about it in clinical sessions. Okay, we don't need to waste time within theory. Any questions about this? Any questions about basic life support? How to approach? So it's very easy. Anyone can do it, even doctor, if you are in the way. How to save life with no resources. Okay? No question? So no one understands what I said.
I have a question, please. Regarding when someone sees someone on the ground, you want to help. Legal obligation for this process. I don't know. In our society, is somehow scared to help someone on the ground, and then you get into problem. You know.
Yes.
How's that in other parts of the globe? You know, we are talking about something universal. Is there something local? Just in other countries.
If you feel unsafe, don't put yourself in this position. Leave the patient. If you feel unsafe, anyway, anywhere, anytime, if you feel unsafe, leave the patient.
So the safety is not just the physical, I mean,
It's a scene, then there is cure. We missed one skilled nurse in Diyar because there was fighting between ISIS and the Iraqi army,
Yeah.
and then stopped. The war stopped at that time. They thought at that time there is nothing else, and that's it, and ISIS ran away. And so the ambulance, the paramedics went there, and one sniper just killed him in place. So, if you feel unsafe, don't go to the patient. You should feel safe. Okay?
Thank you.
Any other question? No other questions? Okay, thank you. Thank you.